Hello everyone. Welcome to another episode. Today, we have with us Dr. Danya KS, Consultant Radiation Oncologist, American Oncology Institute at BMH, Kozhikode. Welcome, Doctor. Doctor, what are the common symptoms of cervical cancer?
Okay, before going to the symptoms, I want to discuss about the spread of cancer. There are three types of spread commonly: the local spread, lymphatic spread, and distant spread. That is, local spread means the tumor can spread to nearby structures, and the lymphatic spread means the tumor can spread to lymph nodes. And third is distant spread. That means if the tumor arising from the cervix, it can go to different parts of the body, that is lungs, liver, bones, etc. In initial stages, that is stage 1, stage 0 stages, patient may be asymptomatic. Patient may not have much symptoms. Usual symptoms of cervix, symptoms of patients usually have postmenopausal bleeding. That means patients usually, the cervical cancer is usually seen in more than 60 to 70 years. And if the patient notices postmenopausal bleeding, that is an important symptom. Menstrual irregularities, that is another symptom of cervical cancer. And vaginal distal, foul smelling discharge, that is another symptom. These are the initial symptoms of cervix. In younger age group, patient may experience postcoital bleeding. After intercourse, patient may experience bleeding after the intercourse. That is another symptom. The tumor spread to nearby structures, like cervix is situated near to bladder and rectum. So the tumor infiltrates the bladder. The patient may experience blood in urine, increased frequency of urine, and if the tumor infiltrates the rectum, the patient may have symptoms like difficulty in passing stools and blood in stools. And the tumor can spread laterally also, and there is ureter passing through the parametrium, and the tumor can infiltrate the ureter also and completely block the ureter. In that situation, patient may have edema of the lower limbs. That is due to renal failure. Hydronephrosis of the kidney, that is swelling of the kidney, may occur, and usually the patient will die because of this renal failure and anemia. And bone pain, back pain, these are other symptoms of cervical cancer if the patient have distant metastasis. Okay, these are the common symptoms of cervical cancer.
So while we discuss about the symptoms, how do we diagnose this cancer?
Yes, we can diagnose this cancer. If we see these symptoms, you should visit a doctor. The cervix can be visualized by doing a perspecular examination. We can see the cervix. If we see any abnormality in the cervix, we can take a biopsy from that. And after biopsy, we can confirm the diagnosis, whether it is a cancer or not. And after confirming the diagnosis, we can do the staging workup, like we can do a MRI pelvis with contrast or CT abdomen with contrast. That will give the information regarding whether the tumor is infiltrating the nearby structures, or lymph nodes are involved or not, or liver metastasis present or not, and bladder and rectum involved or not. These information we can get from these investigations. So we can get the staging also. If we suspect distant metastasis, we can do a PET-CT, that is a whole body PET scan. In that, after doing that scan, we can see the local disease also, and also the distant spread. If there is any distant spread, we can see in the PET-CT. So these are the investigations we can do during the checkup, and these small investigations, we can diagnose and stage the disease. After the staging, after workup, we have to stage the disease. After that, we will advise the treatment.
So we talked on the symptoms and diagnosis. Now, how do we treat? Like, what are the common treatment practices for this cancer?
Yes, initial stages, stage 0, stage 1, surgery may be a good option for this patient. That is not a hysterectomy or a simple surgery. That is a the expertise surgery should be done. That is modified radical hysterectomy with lymph node dissection. That is usually practiced in cervical cancer patients. And initial stages, that may be enough for the patient. If we see any risk factors in the pathology, we have to give further treatment like post-op radiation to the surgical bed or pelvis to prevent the local recurrence. In locally advanced, that is stage 2 onwards, stage 1B onwards, we can treat the patient with concurrent chemoradiation followed by brachytherapy. That means the whole treatment will take almost 8 weeks, and the radiation is given to the pelvis with the external, that is X-rays or gamma rays. We can give radiation to the pelvis. Along with that, we can give a small dose of chemotherapy to enhance the effect of radiation. And after this external beam radiation, we can give a small dose to the tumor site to give a high dose to the tumor to control or cure the disease. And that is called as brachytherapy, intracavitary brachytherapy. And the whole treatment will take almost 8 weeks. So this is the radical, that means curative line of treatment for CS cervix. The tumor spread to distant parts, palliative chemotherapy and palliative radiation is used in cases. The one thing is that the cervical cancer is curable if we detect the cancer in early stage. That is the important thing we have to know.
Okay. So although doctor has mentioned that cervical cancer is curable, there is always a considerable fear while dealing with cancer. So in case of cervical cancer, what are the risk factors?
Yes, the major risk factor for cervical cancer is human papilloma virus infection. 80 to 90% of cervical cancer is due to human papilloma virus 16 and 18. That is the most common strains that can produce a cervical cancer. And other risk factors are multiple childbirth, multisexuality, sexually transmitted diseases, oral contraceptive pills usage more than 5 years, and poor hygiene, and immunosuppression, human immunovirus infection, HIV infection. This can produce a cervical cancer. The most common risk factor is human papilloma virus infection. The time lag between the human papilloma virus infection produce a small change in the squamo-columnar junction, and it will transform to cervical cancer. That will take a 10 to 30 years. And if we detect this virus infection in this period, we can treat the human papilloma virus infection. At that period, we can prevent the conversion of cervical cancer.
So doctor, can you just elaborate on the preventive measures of this cancer?
Yes, we can prevent this type of cervical cancer. 70% of cancer mortality can be prevented by doing a pap smear screening test. That is, screening test. What is meant by screening test is that it is doing in normal population, and we can detect the asymptomatic individuals with the early stages. That is the another thing. So if we detect the cancer in early stage, we can completely cure the disease. If we detect the cancer in 0 stage, we can prevent the cancer also, because most of the cases 80 to 90% are due to this human papilloma virus infection. If we can treat the human papilloma virus infection, we can prevent the cervical cancer also. Another thing is that there are vaccines available for cervical cancer. That is Cervarix and Gardasil, 2 or 3 doses. We can give it to 9 to 26 years of girls, and we can prevent this human papillomavirus in later stages. So we can completely cure, or we can prevent the human papillomavirus infection and safely prevent the cancer, cervical cancer also. That is another thing. Okay, in case of cancer, cervical cancer prevention.
So, doctor, as we conclude today, can you just share one last message for the general public on cervical cancer?
Yes, cervical cancer is a curable malignancy. If we can detect cancer in early stage, we can completely cure the disease. And if you have to know the symptoms of cervical cancer, and if you see these symptoms, you should consult a doctor. And there are screening tests also available for cervical cancer. You should participate. Pap smear screening test is a good screening test useful for cervical cancer, which can detect the cervical cancer early. That is the message. We can prevent the cervical cancer if we can go through this screening test. Thank you.
So, with that, we wind up today's episode. Thank you so much, Doctor, for your valuable information and time. We'll be coming up with another episode with another topic next time. Thank you so much.